Hello, everyone, and welcome back to Let's Talk Business. I am your host, Rick Jenkins, and I am glad that you are with us. It is time for our next guest, and our next guest is Matt Caldwell. Matt is the market president for Bon Secours Health System. Matt, he's been here since 2019, but I think everyone knows this, but Bon Secours, they are a not-for-profit Catholic health system. They were founded in 1983, and for those of you who don't know, and I didn't know it until I looked it up, but Bon Secours is French, and it means good health. Matt, welcome to the show.
Well, it's great to be here, and it's always fantastic to be able to represent St. Francis.
I'm sure it is, and I have been to that hospital many, many times, for family and everything. And I will say this, cafeteria is best hospital cafeteria food I've ever had in my life. I will say that. Chicken wings, can't beat them. Okay, Matt, I want to talk about you for a minute before we get into business. Man, you have been everywhere, right? We were talking a little bit before we came on the show, but you were, you started in this industry in nursing, and you got a degree in Kansas. Did you tell me you were born in Florida?
Born in Florida, lived all over the South, got a degree in nursing in Kansas.
Right.
Did actually worked at a nursing home when I was in high school in Oklahoma. And
oh, my goodness.
After I graduated in Kansas, worked in Oklahoma for a while, then I worked in Texas and got my master's in healthcare administration at University of Texas, Arlington.
And you were in Tennessee for a while. You went to Ohio for a while. And then all of a sudden in 2019, you find yourself in this place called Greenville, South Carolina.
Yeah.
My goodness. So let me ask you this. You were in Texas for quite a while, right? I mean,
right.
How many years?
15 years.
15 years in Texas. Dallas,
and on the border for 5.
Exactly. Okay. So tell me, what is the difference between Dallas, Texas and Greenville, South Carolina?
Well, I didn't get to see them. I didn't get to see the mountains every day going to work.
Right.
So that's one big difference. But there's a lot of similarities.
Really?
Between the people of, I would say, even Tennessee, South Carolina, and Texas. A lot of kind of very similar. We're all in that Bible Belt, very faith-based, good people. And I think you see that now with the influx of people from around the country going into Texas or coming into South Carolina or going into Tennessee.
You got that Southern charm in Texas as well?
They have a Southern charm. They got some good food in Texas, a lot of unique places in Texas. And of course, being there that long, and both of my boys being born there, you have to be a Cowboys fan. A little bit tough after this last game, but we'll bounce back.
Right. So still a Cowboy fan. Now you've been here long enough. Have you chosen yet between Clemson or South Carolina?
Well, I've chosen Clemson. Yeah, I know it's got to be careful there. I would say I am Clemson affiliated through tuition. My son is doing his first year there, and he actually won his first game. He's a hockey goalie. Won that this last Sunday.
Well, no one can argue with you being affiliated through tuition. You gotta root for the Tigers if your pocketbook is involved. All right, Mark, let's talk, let's talk business. And let's talk about remote care.
Okay.
Let's start right there. Now, in March of 2020, this thing called COVID occurred, and it changed the way a lot of industries were doing business. Now, in the healthcare industry, we were already kind of going down that road with telehealth, remote care. We were going down that road, but I believe we sped up a little bit once March 2020 hit, yes?
Yeah, it really is unique. It's been cyclical over the years in healthcare, and I think you've seen it, even if you start way, way back prior to the wars, there's always been a push for getting health as close to home as you can.
Yeah. Right.
And we've seen that through that. When we had home health in the 80s, you see that cyclical with infusion care. And then when COVID hit, we really saw the push through technology to try to get at least primary care visits, if possible, done through a tablet or through a computer or a device. And that does have significant advantages, but it also our technology still hasn't caught up with being able to really assess a patient. And I think that's still where we're working on, the ability to assess a patient from head to foot. And so our physicians are great, and they continue to use the tools that are available for them, but there's still nothing like being able to see a patient across from them and assess them.
Do you have any feel for what % of the patients are falling into that telehealth circumstance?
Yeah, during COVID, our numbers went up drastically, like I'm sure everybody's did. And it's fallen back now below 10%.
Okay.
And what I would say is there is a segment, and it's not necessarily the segment that you would think. It's really kind of barbell shape, if you would think about it. Really young, active individuals that are really kind of comfortable with using technology will access that. And you will see people jumping into that field, even like we've heard this week, Costco trying to jump into primary care. We've heard Amazon trying to jump in at varied success levels. And so those that just need to get, hey, I'm got a stuffy nose, not feeling well. But you also are starting to see that with some of the elderly population because of their ability to ambulate or to get into a doctor's office, that they're accessing a primary care physician or maybe a specialist through some kind of telehealth.
Look into your crystal ball a little bit, and what do you foresee, 10 years down the road? I mean, where's telehealth going to wind up? Well,
there's a big push now to have hospital at home, and you'll hear that kind of term thrown around, and there's been some capital investment, private equity investment into that, where they're really trying to get technology at the bedside and then having providers, whether that be nursing or physicians, being able to monitor that health at home. And so I guess if I had a crystal ball, there would be some kind of ability to monitor a patient that needed what I would call basic diagnosis. Maybe they had congestive heart failure or COPD. While those are not basic in the nature, sometimes the treatment of them are pretty regimented. And so you can kind of look at that through that crystal ball, if you will, to say, can a provider observe, assess, and treat a patient with extensions of nursing or therapy or what have you. Right. I think inside that crystal ball, though, as well, I don't think that there's so much capital intensity inside of hospitals that we will always need ICUs. And I think as the years have passed and as my career has passed, hospitals have become more acute. And I think that's what we're seeing today. People that come in now are much sicker. They have to be much sicker when they are admitted. And the treatments that we do, especially during the pandemic, the intensity of those treatments have gone through the roof.
Let's change gears a little bit and talk about staffing shortages. It is a trend that has plagued somewhat the medical industry for some time now. Of course, it was exacerbated by what happened with COVID back in 2020, but it continues to be a little bit of a roller coaster, as I understand it. Tell me where you guys stand with getting good folks in.
Well, it's interesting. Prior to the pandemic, we call them agency, and so that term is a little bit of a broad term, but an agency would be somebody you go out and hire for just a certain amount of time, and then you release them. So they're not a full-time employee or even a part-time employee. And before the pandemic, we didn't have any. We didn't have any in the whole system. We have about 3,500 FTEs, about 5,000 people that work for Bon Secours St. Francis. We didn't have any. When the pandemic hit, for various reasons, either people contracting COVID or people traveling out or people not traveling, we had a spike, as well as every other hospital that I know, had a spike in getting agency to come in, help us through those times. And it was really crucial. I think, so I'll take it in two sections. The first section I'll say is everybody non-provider, so non-physician. So we recruited those agency and we had them come in. Where we stand at today is we are much better. We are almost at pre-pandemic levels. There is a draw to St. Francis that employees have. It's nothing to see when you walk down the hall, people that have worked there for 25, 30, 35, 40 years. I even have them in my office that have worked that long because there's a draw to the mission. And so I think we're starting to trend back that way. When it comes to providers, the same thing happened. A lot of providers kind of sheltered in place, and it was tough to recruit primary care and some specialists through the pandemic. We're starting to see that ease up some. The northern part of South Carolina is easy to recruit to because it's so beautiful and growing so fast. And we are hiring, almost every day we have some recruit in looking for a place, whether it be a specialist or a primary care. And so hopefully we can continue that trend, but it is tough around the states. And we've seen, I will throw in this last comment, hospitals are struggling. During the pandemic, there was a hospital around the U.S. closing about once every 4 or 5 weeks. They were just closing. And we've even seen that close to here. We saw the hospital in Atlanta, Georgia, Atlanta Medical Center close because of, there was a whole lot of things around that, but I'm sure finances were part of it. And so it's a very tough business to be in, but fortunately we have a very, very good hospital system in the upstate, and very fortunate to be a part of Bon Secours Mercy Health.
You got a new ambulatory surgery center.
Yes, we have one coming up. That's true.
Hasn't opened yet.
Opens up in the first, hopefully the first week of April.
Yeah.
It will have 6 beds. It'll be on by our cancer center over in Malden, kind of by CUI car, which I'm sure a lot of your people know where that's at. It really is groundbreaking, and I use that term a little bit loosely because it is a partnership with some orthopedic doctors and with some ENT doctors and pain doctors. They partner with us, and we have a group named Compass that manages it. And we really are trying to get the treatment of high quality, which we have a fantastic set of orthopedics, ENT, and pain doctors, and lower cost to the patient on an ambulatory setting. That's the whole idea behind it. So when it opens up in April, it should be lower cost for our patients. It's all day surgery, and we have some fantastic robotics that will be in there as well. And it's going to be an exciting time for the upstate.
Tell me about the robotics.
So it's interesting. We've had robotics, general surgery robotics, for years, much as our competitors as well have had Da Vinci. But we were the first to come in with orthopedic robot. And what that is called Makoplasty. That's the first one we had, called Mako. And what they did is they would take imaging and apply inside of an arm, a robotic arm, with a physician at the bedside always overseeing this. And the idea was to have a bone, we call it bone sparing. So it doesn't carve away more bone than it needs. And then the second thing, maybe more importantly, it creates a better fit. And so when you go in to have a knee, and we will soon have hip, when you go in to have a knee, there is a better fit for people going in there. When I started my nursing career in orthopedics, somebody would come in to have a total knee. They would be in there one day, they may be discharged in 3 or 4 or 5 days. Now you can walk in the morning and walk out in the afternoon with a new knee. That's kind of the technology that has been introduced even in my short career. And so we're excited about presenting that in that ambulatory surgery center as well.
Technology today, huh?
It is fantastic.
I can't fathom it. I just can't fathom it.
It really is neat. And it's so exciting to see patients who have come in with struggle with some kind of arthritis or some kind of issue with a knee to have a new knee and then walk out in the afternoon. Now, they still will do therapy, but it's just fantastic ability.
You've got a new medical campus.
We do. We have a new medical campus in Simpsonville. We opened up a freestanding emergency department April of last year. And so we've been about a year and a half we've been open. And it really has done well for the residents of the Simpsonville, Fountain Inn, kind of that area. And we really wanted to bring the quality that Bon Secours has been known for 90 years into the Simpsonville campus. We didn't realize when we put it in there how fast that area is growing. We thought we knew, we didn't know.
Right.
And it is just exploding down there. And it is doing great, and the satisfaction from the patients is top notch.
Yeah, I live down close to it, and I drive past it every time I go to Lowe's, which is it's next door neighbor, and it's a beautiful campus and a new spot there. You've also acquired some urgent care centers. We have. We had an arrangement, what we called AFC Urgent Care, and we had 8 of them in the upstate. There was another kind of branch of AFC that had 7 of them, and we acquired those 7. So we own all of the AFC Urgent Care in the upstate right now, and we'll have 3 more open before the end of the year. And they really are all over the place, as far south as Greenwood, far north as Boiling Springs, and soon to be Duncan, and we have them all over Greenville County as well. And what that's done is it's kind of fit a need for what I would consider primary care. Some patients need to see a physician or a provider, not emergently, but urgently, and that's what's fit that need. There is tremendous volume goes through there. We will probably see north of 200,000 people that will use those urgent cares, especially as we go into the winter months, because they want to go in, hey, do I have the flu or do I have COVID? Is this an emergent case that I need? And it's interesting because people are getting so smart and utilizing technology and accessing the appropriate access point. And that's what it's there for. Let's keep it with technology for a second. I'm going to get you out of here on this. Artificial intelligence. Artificial intelligence, it's rearing its head in almost every industry that there is.
Yes, it is.
And it's amazing. And the healthcare industry is no exception to that, of course. You got robots doing surgeries. What about artificial intelligence?
Yeah, AI is leaning in on healthcare as well. Some of that we've already done with Viz AI is already coming in. It helps us with stroke determination. Yeah. We see it through teleradiology as well. But it's interesting as AI leans in. I even read it today in one of our healthcare publicities that it's helping decipher what's an outpatient and what's an inpatient. Some of it's helping decipher with pathology reads, or with radiology reads. I think the advent of that will continue. The issue is AI right now is as good as information as you put into it. You'll get that out. Unfortunately, some of our patients, and I'm sure over time, they may not tell quite the whole story about what's going on. And that's why our providers are so important, because for them to truly assess that patient, somebody will come in and say, hey, I've got shoulder pain. And really what they need to tell you is they got chest pain. And so we continue to lean on our providers. We will use AI as a tool. We need to. It needs to be a part of that, but we need to use it smartly and as we march forward.
Matt, good stuff, man.
Yes, sir.
All kinds of good stuff happening at Bon Secours Health System. This is Matt Caldwell. He is the market president for the Greenville market for Bon Secours. Folks, that concludes another episode of Let's Talk Business. I'm glad you joined us. We'll be back next week, and you can always get us on YouTube or on any of the podcast platforms. We'll see you next time.